Hey everyone, welcome back to another episode of the Scrubbed In Show. I hope you've all been keeping well. This week we're joined by Dr. Catriona Maybury, who is a consultant dermatology as well as the medical director for Healthtech, which is an umbrella of many brands that are famous. And one of them, which you may have seen pop up on social media recently, is Dermatica. So it's an absolute pleasure to have you on the show today, Catriona. How are you?
Hey, thanks for asking me.
So you have done a what we call a portfolio career, something that is super topical now. So really keen to kind of delve into your journey of not only becoming consultant dermatologist, which is super competitive in its own right, but also the fact that you have now delved into the world of health tech, medical content, which is also super popular. But I want to kind of really take it all the way back, a young Catriona. Tell us about your motivations to study medicine, to kind of become a doctor. Where did that all stem from?
Sure. I think probably the strongest draw was I always wanted to be around people. Forget careers, just, like as a child, I'm an extrovert. I was really social. And I think I always knew that I wanted a job that involved working with people. And then later, I suppose, when I started, progressing through school, I also knew I wanted to do something with an intellectual challenge. And then I would say that I'm privileged and I'm lucky, and there's lots of doctors in my family. I come from a very medical family. And probably if that wasn't the case, I don't know if I would have gone into medicine. I think I probably would have gone into, if not medicine, then psychology, or, probably still something aligned to working with people, something that had an academic kind of side to it. It might not have been medicine per se. So I think, it's that combination of exposure to medicine and then some elements of, core personality traits probably. And the other thing that really appealed to me, that still appeals to me, is how innovative medicine is and how much it's always changing. And I think I always knew early on that I probably wanted to be in a space that was evolving fairly rapidly. And, if we look at my career, I've stuck to those early thoughts. So that's quite a long answer to a straightforward question.
No, definitely. It's good to kind of get inside your head and understand why you made the decisions. Out of curiosity, what were the specialty your family pursued? Were they dermatologists? Did you kind of get that first-hand exposure?
No. So there's lots of GPs in my family, cousins and grandparents, and a sprinkling of other things, but definitely nobody was a dermatologist. And I didn't do dermatology until I, was kind of maybe 6 years post-grad. So it didn't come to me initially either. I started off really enjoying the kind of acute specialties. I worked in Australia and New Zealand for a while after my F1, F2, and I definitely loved A&E and intensive care and all those kind of high adrenaline specialties. But I think that at some point in my kind of late 20s, I realised that I probably wanted to have an academic career, or a strand of my career that was academic. And in those acute specialties, it's possible, but it's harder, or it certainly was years ago. And dermatology is a small specialty, but it's quite academic. It's quite research active, and that really appealed to me. And also I really enjoyed doing practical procedures. When I was like a medical reg, I enjoyed central lines and, putting in drains and all that kind of thing. So I knew that if I was going to move out of acute, at that point in my life, I wanted something procedural as well. So it was kind of dermatology. I remember when I looked into it, it had elements of things that I really enjoyed. In terms of procedures, still high patient contact, and then looking to the future, I wanted to develop this academic side, and there was potential for that. So that's why I decided to switch into dermatology.
Tell us a bit more about this academic drive. Is that something you've grown over time? I know you did a PhD and it was around psoriasis. Tell us a bit, why you want to kind of pursue this career and have an academic element to it, research. Because I hate academia, I hate research. It's not for everyone. So I'm always curious to know why people love it.
I think, after a few years of being a doctor, I realised that I really love the one-to-one interaction. I still love it, actually, when you see a patient one-to-one, but I think I started realising that I wanted to maybe explore things outside of that one-to-one interaction and look at, do some work that could maybe contribute to improving a service or treating people on a more population-based level. I mean, not as an individual. When you do research, you're building on the work of others, and it's very collaborative. But that just appealed to me, that kind of approach of stepping outside of the one-to-one and looking at the bigger picture, and also the opportunity to develop new skills. I could see that people that had done research kind of thought differently, maybe had more critical thinking, and I just thought it would also make me a better doctor to develop some of those skills and have a period of time doing research and then coming back into the clinical space.
Tell us a bit more about securing that training number, securing kind of derm training, because it still today remains super competitive. Loads of people have multiple attempts, and it's one of those kind of god tier specialties: dermatology, ophthalmology. Tell us what you did to make yourself get into a role, especially when it's super, super competitive.
Yeah, I think that I was very strategic, and that's kind of what I would advise other people to be too. Dermatology is very competitive, but what you need to achieve is fairly obviously laid out there. I mean, I don't think there's any kind of secret to it. It's difficult, but it's all out there, and how you have to gain a certain number of points across a certain number of activities to get through to interview. And then if you get an interview, you have to perform very well at that interview. But I think anyone can learn how to do that, and anyone could approach that in a strategic way. So sometimes when people would come to me and they would say, here's my CV, I've applied a few times, I'm not getting through to interview, I'd say to them, why are you doing another audit this year when you've already got 8 and you're not going to score any more points there? But you, in this category, you're missing. So be strategic in where you focus your efforts. And so I think that I looked at the matrix and I realised, these are the areas of my weakness. I need to lean into them. And then when it came to the interview, I just prepared for it very carefully. I did a lot of practice, and now I'm still helping other people in preparation for interview. But lots of people I think, oh, I'm not good at interviews, or I'm not good at presentations, and these are all just stories we tell ourselves. I think all of this is learnable.
Yeah, I like that. I like that everything is learnable, or figure outable is another term I've recently heard. Tell us a bit more now that you've well on your way on dermatology, becoming a consultant. Tell us when you start to kind of develop this portfolio career. I saw you were kind of writing for BMJ, doing some sort of strategic advising. When did that happen in your career, and were you always conscious you wanted more than just being a clinical dermatologist?
So I did arts A-levels. I did history, English and French, and I really always enjoyed writing. And I think I always knew that I wanted to write in some way. But for the first few years after I qualified, I was so consumed by the job that I didn't really have an outlet for that. And I didn't think about it too much. But as the years went by, probably about 5 years post-qualification, I started to think, how am I going to get some of these analysis writing skills into my career? And obviously, research is a great channel for that because you do so much writing when you're doing research. So during the time of research, I did a 2-year post at the British Journal of Dermatology as well, which was, I think it was called editorial trainee. And I was just doing, some editing and short pieces of writing, but I really enjoyed it. And then I went back into kind of clinical medicine. For my last year of being a registrar and first 1 or 2 years of being a consultant, I just focused on the clinical work. And then during the pandemic, my life changed and I wanted to be at home more with my children. And I reduced my clinical work then and got this job working for B&J Best Practice, where I was the dermatology editor. And that was kind of so what I think, if I look back over the last, I've been a doctor for 19 years now. These other interests have kind of ebbed and flowed, and sometimes they've come in and sometimes they've come out, and sometimes I've done more clinical, other times I haven't. And one thing I do hear talking to people that want to develop a portfolio career is I think they feel like they've got to get to a day and then say, right, my portfolio career starts tomorrow. But actually, I think it can be fairly fluid whilst you're developing it. I think you can do bits and pieces, keep working and develop skills, stay aware of what you're interested in, what you enjoy over time. I mean, you're right that most people seem to be transitioning now out of clinical medicine into health tech at an early stage. I obviously didn't do that. It was a very slow transition for me. And that worked for me. And I think that's fine too. I don't think I think the great thing about developing a portfolio career is it's so bespoke. You can choose what you do, but you can also choose the rate and the time and how much of clinical versus other things that you do. Yeah, I was going to say, there was a period of time, like for me, it was towards the end of my training where I thought, for anybody that's doing specialty training in that last year, you've often got so many boxes to tick that I realised I just need to give this my full focus at the moment. And then again, when I was first a consultant, I thought I really need to just focus on this for a while. And I made the conscious decision not to do anything else in those few years. And that was the right choice for me at the time. And then later I felt ready to pick something back up again.
No, I agree with you. And I think you are right. Having a portfolio career doesn't mean you need to do it from the get-go or you have to wait till you're a certain stage of your career. It does come in ebbs and flows and you can kind of fully pursue that. I think by nature, medics are kind of this type A personality, high achieving, and they want to do everything as soon as possible. And sometimes that comes at the detriment of so many other things. And I like the fact you said during COVID, you want to spend more time with your family. You took that step back, right? And sometimes making this decision is so hard when we're in such a, sometimes it's a bit of a rat race, if I'm honest.
Oh, yeah, I think so. I think we're all conditioned, basically, to compete and to work really hard. And I think it can be quite, and we also all feel, or many of us feel, a real loyalty to the NHS and feel that we have to kind of stay committed to the course. And I think it's quite hard, or it can feel quite hard to break away, or you feel that you're letting people down if you choose to do something else. And I think it's worth taking time, like, for yourself. I think about it on dog walks and things like that to kind of work through some of those thoughts and feelings before making any decisions.
No, definitely. Tell us a bit more now about this role at Dermatica and then Helios X. I think for a lot of people, they're confused as to are they one and the same? So if you could kind of clarify that, and then a bit more about the opportunity at Dermatica, how you got that and what you were doing there.
When I was working at the BMJ, I decided to update my LinkedIn profile. And as soon as I did that, I put that I was a clinician and I was also writing for or working for an app, clinical decision-making app. Some health tech companies approached me for contracting work. And I initially did some work for a company called Nabla, which I think is doing very well currently, using AI. They've kind of pivoted actually from what they were doing. Yeah, exactly. I mean, even then, I could tell that Nabla was a smooth operation. Everyone I came across that worked at Nabla was really bright and engaged. So I did some work for Nabla, and then Dwayne, who is still involved, but was the CEO of HeliosX, contacted me via LinkedIn and said, we're looking for a dermatologist to work on Dermatica, and can we set up a call? So that was, my introduction to Damascus. So absolutely keep your LinkedIn profile updated. So I started off just doing some contracting work for Damascus initially in 2021. And then I became medical lead for Dermatica. And then recently, medical director of HeliosX. So Dermatica is one of the HeliosX brands. So HeliosX is also MedExpress in the UK, Zip Health in the US, Rocket and Levity in the US. So, like you said at the beginning, an umbrella of health tech companies. And my role as medical director is very varied, similar to probably other medical director health tech roles. A large part of it is kind of ensuring the safety and quality of the services we provide, and that is through clinical governance, not totally dissimilar to the kind of way you would approach clinical governance in the NHS. We do audits, we do quality improvement, service evaluations. We look at make sure all our processes are, compliant with regulation. So that, I think that's a really significant part of the role. So working with the operations team to make sure products and services are safe and effective. And then also working with product and growth teams, making sure the pathways are as user-friendly as possible. And that's kind of a really novel, interesting side of things to me, and obviously somewhere where I think we could improve hugely in the NHS. But it's nice to be in a more agile space to be able to do that kind of work. And then probably the other big content area is content, the generation of clinical content, and also making sure our content is safe and accurate. And so that's content both internally, or the comms that go out to customers via email, and also obviously blogs, social media, website content. So they're kind of the job's very varied, and also that I do see myself as making sure that kind of like a voice of the patient or the customer. I think one thing, you talked at the beginning about what value do you have as a consultant as opposed to a junior doctor. I think one of the values of being a consultant is I have many years of seeing many, many, many patients now. And I feel like, I have a good insight into people's hopes, fears, concerns when it comes to their health and to the delivery of healthcare. And I feel like I'm able to have an informed view often on how people might perceive things or how they might experience things. Obviously, there's variation. We're all individuals. But I think that one benefit of many years of listening to people and listening to their experiences of health, how it's delivered, as well as the disease itself, does give you that informed view.
No, thank you for sharing that. And it's nice to see the role has many pillars and aspects to kind of get your hands into. The one question I had is, a lot of these roles are within startups, high growth companies, which are very commercial at its core. How do you kind of resist the pressures of being able to deliver fast, ship quickly? Because a lot of the time, the it's the regulation, the medical side of things that are slowing the company down. How do you kind of hold that thought and be like, wait a minute, we need to make sure we do things correctly?
That's a very good point you raise. Firstly, I would say that some of this is about having good working relations with people within the company and building trust with them and mutual respect. And I'm always try to be cognizant to the commercial demands because, I'm working for a business. And I think if anything's changed over time since I joined the company, I think, my knowledge of how business works and my understanding of that has improved. So I think that the people I'm working with internally know that I appreciate the demands of the business. When I'm thinking about things or giving advice, I'm aware of that. But then I also have to be, decisive and confident with the medical opinion, which is sometimes, like you alluded to, in contrast with what the business would like. But I've not found that too difficult. I think that, again, probably having more experience, because I'm a consultant, means that I have experience of making decisions within the NHS that affect other people working or beyond me. If you've already had experience as a consultant of making managerial decisions or writing documents or policies or whatever that might influence people beyond yourself practicing, then I think it's easier to translate some of those kind of it's basically leadership skill, isn't it, into health tech. It still is, there still are moments of tension sometimes, but I think we've always resolved them pretty quickly, and that's an interesting part of the job, actually. Where you're looking at commercial versus regulation versus maybe what's best for a customer or a patient. I think that's kind of at the heart of what makes it quite an interesting job sometimes. So I wouldn't say that I back away from those discussions. I find them quite stimulating.
No, that's very interesting to hear. And I do agree, being a consultant, having that many years in a leadership position does help. You're in a unique position where you are a consultant in the NHS, clinically, as well as a senior leadership position. What makes a good leader?
I'm still on a leadership journey. I think being as self-aware as you possibly can be, and having a clear vision that you can communicate to other people about, a standard that you want to aspire to in the way you practice. Definitely at Helios X, I feel like I try and keep the standards for the medical work high, and I want to communicate to the other doctors working with me that we should aspire to have high standards whilst moving at speed, still being safe and accurate as much as possible. Like, that's very important for me, and I do try and communicate that to them too. And I think as much as possible, obviously, supporting and appreciating the people that you work with and helping them to develop their own careers. That's what I aspire to do. I don't obviously always achieve it.
I can tell you're a good leader because you're still on this leadership journey, and that is very good insight, which is very nice and refreshing to hear. We have to talk about content. And there is a rise of clinician creators, more and more clinicians, some of them junior, some of them senior, are going online on TikTok, Instagram, creating a lot of content. And there is some sort of misinformation happening. What advice would you give to clinicians like ourselves that are perhaps junior, that want to kind of join this wave of creators or the creator economy? What do we need to be mindful of?
I think because I did research, I really do believe in evidence-based practice. And that is a value that is consistent across probably practice for me and writing and every, strand of my career. So if I'm telling something to a patient face-to-face or writing something online or considering a business decision, I would want to know myself clearly what the evidence is, and also where there's a lack of evidence, why there might be a lack of evidence. I appreciate in some of the TikTok trends, they're actually, people almost zoom into areas where there might be a lack of evidence because there's some controversy there. But when we're in areas where there is evidence, I think it's really important that doctors should translate that. That's how we can retain our authority online. We've been trained to appraise evidence and use it. So I think we should do that in content as much as in traditional practice. So if you are new to content creation, I think there's value in, understanding basic medical statistics, understanding hierarchy, levels of evidence, how to interpret a trial. That's where you can bring value as a doctor if you have some skills in how to appraise evidence, to communicate it.
No, I think that is helpful. And I think as clinicians, you can never go wrong when the content is based on evidence. Moving on around content and social media, especially in the work you did with Dermatica, tell us a bit more about kind of the increasing pressures young people face when it comes to skin, when it comes to aesthetic products and that world, and what can we do to stop it? What do companies like Dermatica stop it, where young individuals aren't too influenced and they're kind of having kind of traumatic experiences and kind of these societal pressures?
Well, it's quite a lot in that one. It's challenging, isn't it? I think that I've always found it a challenge in dermatology, actually, like this overlap or this fine line between treating skin disease and then, the overlap into beauty and appearance. It definitely, when I wanted to go into dermatology, like I said to you earlier, it was because I had an academic interest and I wanted to do procedures. I actually wasn't really focused on aesthetics or beauty in that decision making, and it only became apparent to me more as my career went by, actually, that this can, there can be a tension there sometimes. And certainly, on the NHS, there is a point to which you say to some people, this is an NHS dermatology service and we're really looking at, treating skin disease. We're not here to give you perfection. And I think you're right. There is this kind of, because of people taking selfies all the time, people having ring lights, the beauty standards probably have unofficially raised in the past few years of how people expect their appearance to be or what they aspire to. Which can be incredibly hard for some people, because if you have acne or eczema, it might be a struggle to have perfect skin. And some of that may be an acceptance, a psychological acceptance that for you, that might be almost unobtainable, or it might be difficult to obtain. So I don't think I've got all the answers there. I just recognise that it's a challenge, and I certainly don't want to be part of this body of people that's trying to tell people this is how you get perfect skin. That's not something that I really want to be part of. I want to tell people, if you have this skin condition, these are the things that we know you can do that are going to make your skin look better. I'm not saying it's going to be perfect, but it should improve. Being, again, cognizant of the fact that how our skin looks, particularly skin in our face, does impact our psychological health. That's well known. When you're out and about in the world, people see you, they perceive your skin health. It's one of the first kind of subconscious things that people will perceive when they meet somebody. So it's very important. So on the one hand, yes, I do want people to have clear skin and to treat skin disease if it's visible, because I know that that's important. But on the other hand, I don't want people to feel depressed or down or anxious if their skin's not perfect.
Thank you for sharing that. And I think it's important understanding this is a big challenge and it's going to become more and more prevalent. I wanted to touch on kind of AI, which is another big thing that's super topical in the moment. And it seems like a lot of the lower hanging fruit seems to be in dermatology because kind of the nature of specialties, the conditions and the things you're treating. What do you think about the role of AI in dermatology as a specialty, and what startups or health tech companies are you impressed by recently?
So I agree that the potential for AI in medicine is huge, and not just in dermatology. So, one of the biggest challenges we face in dermatology in the UK as a profession is the increasing burden of skin cancer because of an aging population, and more of us are exposing ourselves to the sun, through holidays, and playing sports and all the rest of it, more than we probably used to. So the skin cancer incidence is increasing, and that's a problem, paired with the fact that we have very little dermatology training at medical school, and most GPs have little or no dermatology expertise, which means that the referral rate for any kind of lesion into dermatology is very high. And there is therefore this huge backlog of, always people are chasing their 2-week wait. Skin cancer referrals departments are trying to get them down. It's really difficult. The department I work for at the moment is doing weekend work, to try and reduce that. So I know that companies like Skin Analytics are using AI to hopefully reduce the burden of managing skin cancer, by consultant dermatologists. And actually, that's something that I have reflected on working in Healthtech. It's kind of amazing working in a Healthtech to see how far, 1 or 2 or 3 doctors can go in the system of hundreds of people. Whereas in the NHS, often, a feeling I've often had is, why are consultants, reviewing people for follow-ups, maybe post-surgery, or why are they seeing people that are, have got mild acne? So I think we will use, hopefully, AI in combination with more efficient ways of working to mean that the consultants see the kind of the most difficult cases or cases of diagnostic difficulty. I think that AI is good at probably, differentiating some types of lesions for others. There'll still be a need for a human in many cases, but the consultants should be saved almost for like the most difficult cases. So when my interest is not in skin cancer, it's in medical dermatology. And again, I think that probably the future applications for AI could be really significant. Again, when we look at things where there's a huge burden of disease and a long waiting list, acne is the prime one. Acne is extremely common inflammatory disease. It affects so many people, and yet GPs at the moment in the UK do not prescribe isotretinoin and Roaccutane, and that therefore people have to be referred in, which means that there's long waiting lists and lots of distress for people waiting. So, potentially in the future, I think we could use AI to do some kind of, you might upload a photo and it may grade your acne, and it will say, beep, beep, you can be managed on antibiotics by your GP, or you can be transferred through to a consultant service, and it can help with that triage. I think the applications are huge. The delays will be in the speed of innovation, that the NHS, the roadblocks to getting innovation through into practice within the NHS. And, we both know there are many, sadly.
Yeah, I agree with you. And I do feel AI can do a lot with kind of the waiting times, the burden of disease, differentiating. I wanted to talk about your content diet, the content you're consuming. You're someone that practices evidence-based content. You probably need to be up to date with a lot of things by virtue of the role you are. How do you manage content overload? Where are you going for your content? Is it LinkedIn? Is it social media? Is it journals? Tell us about that mix.
Sure. So I have like old school post delivered through my door, BMJ, British Journal of Dermatology, and Harvard Business Review, those three. And the Financial Times, actually, if you count that. I think it probably is relevant to business world. So they're like my paper things that I would read. And then, yes, absolutely, I read lots of content on LinkedIn. And I have mail shots, like journal. I'm on the New England Journal of Medicine, the Lancet. I get them all, the weekly mail shots through to my email. And then we're really lucky at Helios X that I think we're quite unusual, actually, that we have a clinical librarian called Laura, and which is fantastic, absolutely fantastic resource. And so in terms of how I can access journals for work purposes, at the moment we are doing a lot of work around weight loss, and Laura is sourcing the best papers, and it's absolutely wonderful. So not only will she find the papers, but she'll read the papers and draw out the main points and help me interpret the data as well. So I'm very lucky that at work I have lots of help in terms of assessing research to translate into content. And then podcasts, I listen to podcasts too. So consuming it in lots of different forms. And also in real life events, I think that going to conferences and, meetings, I still find those really valuable. I went to the European Association of Dermatology meeting earlier on this year in Berlin. And there is definitely something about still, I think, sitting in a live forum, listening to a lecture and then actually having real life discussions with people immediately afterwards. I still think there is value in that, more so than sitting at home watching webinar, although I do that too. So I think I access content in all sorts of ways.
Yeah, no, it's interesting to see you're taking content in all the different shapes and forms it comes in, whereas some people, they just stick to one or two modalities. I wanted to ask, having kind of doing both, how do you manage kind of that work-life balance? How do you balance motherhood, looking after your children? Any advice for other females and mothers out there that are sometimes caught up in the world of having this career? Because we do have lots of people reach out to us, and obviously we can't answer those. So it's always interesting to hear from people like yourself.
Oh, this is a bit difficult. This is similar to asking me about leadership. I'm like, I've got two sons who are 10 and 7. So I've been a parent for a decade now, but I still feel like I'm really learning. I'm still learning. Thing that I live by is when I'm decision making, I think about how this will affect them. Should I do X, Y, or Z with my career? How would that benefit them? How might that be detrimental to them? So that's in terms of, my current job. One of the best things about Healthtech is it's so flexible. And the NHS is not a flexible place to work for most people, sadly. All my years working full time in the NHS, I would have to leave the house early. Often to be, when I was training, we used to have MDTs that started at 8 or 8:15 most days of the week before clinic. So I would be leaving at 7ish to get in for an MDT at 8, followed by clinic. And I look back to all those years when my children were small and I was doing that, and now I'm just so grateful that I can take them to school and, go to their events. So the world outside of the NHS is more flexible. So yeah, I think that, the main thing is to consider them. And I don't think like I said, at certain times I've consciously decided to focus more on them and less on my career. Definitely in COVID, I knew that I needed to be at home more, and I pulled back from my career, and I felt very happy to do so. And then, at the moment, I feel like I'm working quite hard. I'm still obviously spending plenty of time with them in the evenings and weekends. So I think it is a real challenge. It was International Women's Day last week, and I saw, Adam Grant, I think he's an occupational psychologist. He posts a lot on social media, but he posted something that really resonated with me, saying, we have to change the expectation of women, not only to do more at home, but to be the ones that are doing a lot of organising and planning and on committees. And, I definitely feel that as more of a burden than looking after my children. I feel that the expectation of being a parent at school is very different still for men and women. It's the women that are on the Parent-Teacher Association and running the class events and doing all of those things. And that's something that kind of the feminist in me struggles with more than actually looking after my children. I'm very happy to look after my children. I kind of struggle with the more societal demands of all the other things women should be doing on top of working and doing that. So if there's something that I would like to see change over the next, 10 years, it might be that balance shifting.
No, thank you for sharing that and being so frank and honest. Final question I have, and we always ask our guests, is looking back at your career, what are you most proud of, and what are you looking forward to most?
I'm most proud of the research that I did, because, I hope that I was investigating, causes and best ways to manage people who have liver fibrosis, people that have severe psoriasis. But it's a very, very, small area of practice, like a lot of research is. But I think that some of the knowledge that we generated as a team through that work will hopefully benefit the lives of people with severe psoriasis. And also the process of doing research taught me skills which I'm now able to apply in different settings that are kind of going to be with me for life. So that was the thing that I'm most proud of. And moving forwards, I think that really this, like I said, this journey of leadership into health tech, I'm just starting, and that I can be part of a system that delivers great care in a different way to people. I think it's inevitable that for kind of non-urgent, non-critical illnesses, that health tech companies are going to absorb more of the care and management of people that have mild disease. I just think that the NHS will only survive probably if the focus is on more complex disease. Now, I think it's inevitable that kind of some of the things that we're treating at Helios X will go to other companies such as ours. And I hope that, in this kind of, I still feel like it's like a first wave of companies delivering that care, that we do it well. That's my hope.
No, I think that is a very interesting point you raised in terms of more and more health techs will pick up the burden of kind of the minor illness, non-urgent care, and be able to deliver a very good job at scale, leaving the complex stuff like those super tricky complex skin lesions to the specialist. And I think that is a nice way to see the future, actually. And I think having clinicians that are as experienced as you are, working in tandem with these health tech companies and not kind of dismissing them is super important as well, which is why I'm glad we had someone like yourself come on to the show to kind of share your journey, share your motivations, and share what you're doing. I think it's refreshing, and it's also nice for other fellow consultants to hear.
Thank you so much for interviewing me. Really appreciate it.